They taught me a huge amount about what could be achieved with surgery in correcting the jaws. And one interesting thing I observed is that they were getting really brilliant results by pulling all the jaws and the teeth forward. Clearly, this was improving the appearance of the patient. Although, interestingly, orthodontists were tending to pull everything back. Now, clearly, this was another contraindication which confused me, and I said to myself, one of those has to be right and the other has to be wrong. They can't both be right. Again, this plunged me into a huge amount of research over a very long period of time. Gradually, I began to realize that the more forward growth you can achieve, the better the appearance of the face. I then began looking at why some of the faces tended to drop down rather than grow forward, and realized it was a very simple problem. It just depends on how much the child leaves their mouth open. Children who keep their mouths closed grow forward. Children who leave their mouths open grow downwards. And the ultimate consequence of that is actually very severe. People who hang their mouths open a lot will grow up to be very unattractive. And I only wished more parents knew this. However, I then switched my plans, so to speak, slightly. Rather than just trying to reposition the jaws, I started working on correcting the actual posture of the children concerned. And I developed an appliance which was only comfortable when the child closed their mouth. It took me years and years to perfect this, but it is now in use all over the world, and it's very simple in concept. It clips into the upper jaw, and all the time the child keeps their mouth shut, it's completely comfortable, but if they drop their jaw, it bumps on the gum and is uncomfortable. Very simple in concept, just rather difficult to certainly think up in the first place, but even to apply in these days. But there were other problems I could see. The principal one was that many children tend to keep their tongue between their teeth too much. You can always recognize this because those children will tend to have lisps. They'll talk a little bit like this, and you'll see their tongue between their teeth. This will always damage the way the teeth meet. Essentially, it tends to make the front teeth meet more than the back teeth, but there are variations. Sometimes the tongue comes forward and the back teeth meet, but there's a big gap between the front teeth. All these problems are caused not by the pushing of the tongue so much, it's just where the patient keeps their tongue at rest most of the time. And I then developed appliances which in the same way would make it uncomfortable if the child keeps their tongue in the wrong place. It's very difficult to teach someone to keep their mouth shut or to put their tongue on the palate where it should be. But using these extra appliances, it's much easier. And that really, I think, is the reason for the success of orthotropic treatment, which essentially is aimed at correcting the growth. You have to remember that it will only work if it is applied during the period of growth, which is why we attempt to start treatment as soon as we can see a problem. And this may be as early as 3 or 4 years old. More usually, we will start at 6 or 7, but it's important not to delay treatment after 8. Even if you aren't going to need treatment, it is wise to get the opinion of someone who understands posture. By and large, these will be the orthotropists. Orthodontists in general prefer to wait for treatment until the child has stopped growing about the age of 12, 13, 14. But orthotropists will usually prefer to start much earlier, and if you have any concerns, I think you should get advice while your child is still quite young.